Two factors that matter when tracking the coronavirus are number of new cases and total hospitalizations. The number of new, not total cases, is the best way for us to see if there's a spike, flattening, or drop over a certain period of time. The number of people in the hospital is key to opening back up, as we need to make sure the hospitals can handle how many beds are taken up because of this virus. Let's first look at the number of hospitalizations for two North Texas counties. This graph shows you the number of people in the hospital because of COVID-19 in Collin and Tarrant counties. First, let's look at Collin County. Other than 2 days in early April when 30 people were in the hospital and a quick spike in late April, this county has remained consistent with the number of people hospitalized. Tarrant County is a different story. Starting in mid-April, you can see this number progressively going up, which includes 34 new patients in the hospital today. Now let's move over to Dallas and look at the other statistic, the number of new positive COVID-19 cases reported day to day. While Dallas saw a spike going into May, the county has started to see that flattening of the curve health officials talk about. However, phase 1 of reopening happened 13 days ago, so we would likely see if that has any impact in the next week. Lastly, these are Denton County's new cases day to day. That dotted line you see, it's a 14-day moving average. The county hit 40 cases on March 26th and 54 cases on March 28th. Both days were connected to an outbreak at a living facility for people with disabilities. Since that point, Denton County has had 30 or more new cases only 3 times, which is why you see that average declining since early April. As another reopening phase begins on Monday, gyms will be allowed to open with certain guidelines. So we likely won't know until later this month if the trends we showed you today will be impacted in any way. In Dallas, I'm Jay Wallace.